Today I'll be showing you how to do a basic pulmonary exam on a patient that presents with pulmonary fibrosis. Always make sure you wash your hands and your equipment before you begin. First, we'll get started with the history portion.
Hi, I'm Tatiana. I'm going to be your student physical therapist for the day. Can you just confirm your name and date of birth for me?
Shika Patel, March 13th, 1995.
Hi, Shika.
Hi.
So today what we're going to do is just ask you a few questions and do a basic pulmonary exam on you. So just to start off, do you have any kind of history of any kind of lung diseases or heart?
No, I don't have any diseases, no.
Okay, and then do you have any family history of the same things? No heart issue or lungs or asthma?
No, I have a really healthy family.
Okay, great. That's great to hear. And then have you had any signs and symptoms lately that are unusual to you?
I've been having some shortness of breath recently, like it's hard for me to catch my breath. And sometimes I just have this weird cough, it's just, there's no sometimes when you cough there's mucus, there's no mucus with my cough, so it feels very dry.
Okay, dry cough, that's great to know. And then with your shortness of breath, is that usually when you exercise or at rest?
It's usually when I even do if I'm climbing the stairs or something, so it's activity, but not I'm working out.
Okay, I understand what you're saying. So not really that much at rest?
No, never at rest.
Okay, just a few more questions. What kind of environment do you live in? Is it, would you say, high pollution or next to any coal mines or anything abnormal like that?
Nope, I just live in a normal suburb in Orlando, Florida.
Okay, great to know. I love Orlando.
Me too.
Do you also have a history of smoking?
Nope, I've never smoked.
Okay, and drinking?
Nope.
Or caffeine?
I drink coffee occasionally.
Okay, that's fine. Would you say you have a pretty healthy diet, or?
I try to eat healthy.
And then I know you said you exercise?
Yeah, I'm a runner.
Okay.
I'm not a professional runner, but it's a hobby I enjoy. Sometimes, when I'm running though, that's when I experience the shortness of breath.
Okay. Are you on any medications for this?
No, I don't take any medication.
Okay, and then going back to your cough, how long have you had that for?
I started noticing it about half a year ago to 4 months ago, maybe.
Okay. So now we're going to move on to the observational exam. So I'm just going to quickly observe and take a few vital signs.
We want to make sure we observe the patient's general appearance and see if there are any scars or abnormalities. Normally, we would do this, of course, looking directly at the skin, but for the purpose of this video, we just have the patient keep her shirt on. We also want to observe her work of breathing and her posture, positionings, and her extremities. Next, we'll be taking the patient's pulse, and we would want to compare this at both sides at rest and during activity. And her pulse was 70 beats per minute, 2+ and regular. When finished taking the pulse, also take the patient's respiratory rate in the same position, and her respiratory rate was 14 breaths per minute, which is normal. Next, we will be having the patient turn her head to a 45-degree angle to make sure she has no signs of jugular vein distension, and this was normal. And then after that, we're going to be taking the patient's SpO2. She had a rating of 98%, which is great. Now we're going to be taking the patient's blood pressure, which is very important because it is common to have pulmonary hypertension as a common morbidity for pulmonary fibrosis. Blood pressure was 120/74, which is a little elevated, so we'll keep an eye on that. Next, we'll be observing the patient's extremities for any signs of cyanosis or clubbing or abnormalities in the skin, and also temperature. And these were all normal except for the clubbing. She did have a little bit of clubbing. Next, we want to make sure her trachea is midline, which it is. Checking for edema. The patient does seem to have some pitting edema at her lower extremities.
I'm going to be moving on to the physical exam now, so I'm going to have to ask you to remove your shirt to expose your back and your chest area. Is that okay with you?
Yes.
Okay, great. And I'm going to be placing my hands on you too. Is that okay?
No problem.
Okay, great.
When examining the costal angle, we want to make sure it is less than 90 degrees, and hers is normal. Normally, we would need to drape this patient, but for the purpose of this video, we gain consent for the remainder of the video. For chest expansion, have your hands on the patient's 10th rib posteriorly and have the thumbs close to the spine, and we want to compare symmetry during inhalation and also exhalation. In this patient, it was normal. Next, we'll be examining for tactile fremitus to make sure there's no gunk in the patient's lungs. And we want to make sure we explain the instructions.
So I'm just going to be placing my hands on your back, and I'm going to have you say 99 repeatedly, okay?
Okay.
Go ahead.
99. 99. 99.
This is done to detect chest wall vibrations,
99. 99.
and we would want to repeat the same thing to the front. And the results on both sides were normal. Next, we'll be examining the patient's mediate percussion, and we'll be doing this both anteriorly and posteriorly. So what we're going to have the patient do is exhale and hold their breath while we percuss, and then after we're going to have the patient inhale and hold their breath. We want to make sure this is fairly symmetrical, with the right side being just a slight bit different. We should be looking for a difference in dull and resonant sounds in certain areas as well. And the difference between inhalation and exhalation will be the patient's diaphragmatic excursion, which was normal in this patient. Next, we're going to be measuring the patient's thoracic excursion, and we do this by placing the tape measure around the patient's chest and make sure it's parallel to the floor and straight. For the upper chest, we're going to be placing the tape measure at the T5 spinous process and wrap it around, and then for the lower chest, we're going to be doing the T10 spinous process and wrap it around. For both of these, we're going to have the patient breathe in as much as they can and take the difference at the end of that deep breath in, and then we're going to have the patient exhale as much as possible and then take the difference of the circumference at the end of that patient's exhalation. To calculate the thoracic excursion, you're going to take the in inspiration minus the end exhalation. This was within normal limits for this patient. Now we're going to be listening to the patient's lungs. So here's a picture for reference since it's hard to see on the video. We're going to start by listening to the patient's anterior aspect and then follow with the posterior. For each one of these, we're going to ask the patient to take a deep breath in through their nose and then out through their mouth, which is very important. Since we know this patient does have pulmonary fibrosis, it is very likely that she will have some fine crackle sounds during the lung auscultation. This will be demonstrating when listening to the posterior aspect. Now we'll be performing a bronchophony and have the patient say 99 while listening.
99. 99.
And we're going to repeat the same thing to the back. With this test, we want to make sure we do not hear 99 clearly. It should be muffled. If it is heard clearly, it's a sign of consolidation in the patient's lungs. This was normal in both sides. Next, we're going to perform a similar test, but instead the patient's going to be whispering 1, 2, 3. And again, we should not be able to hear this. We would also like to perform this test posteriorly. This will be doing an egophony test, and the patient is going to say E, and we should not hear through the stethoscope that it sounds like A. This would also be performed posteriorly, and both for this and the whisper test, the patient was normal. Just to summarize our findings for today, our patient had pulmonary fibrosis, and these are some of the symptoms that she presented with, which is very common for her diagnosis. She had a dry cough, which was non-productive for over 3 months, clubbing in her fingers, fine crackle sounds when we listened to her lung, which is very common, and she also had a blood pressure that was a little bit elevated, and she also had some shortness of breath with activity. So we want to make sure we monitor these symptoms. Other symptoms that we want to be on the lookout for patients that have pulmonary fibrosis are, of course, the ones that our patient presented with, along with fatigue, any kind of shortness of breath, weight gain, and of course any progressive symptoms or abnormalities in her pulmonary or cardiac history.
Thank you so much for letting me examine you today. Have a great day.
Thank you. I'll be coming back. I really enjoyed this.
And remember, patient rapport is number 1. If they go in for the hug, don't deny it. Thanks for watching.